It's quite frequent that I say that mommy makeovers are truly transformative procedures, and I don't think that's an exaggeration at all.
Welcome to Behind the Double Doors, the Houston Plastic Surgery podcast with Dr. Bob Basu, telling the stories of plastic surgery patients and bringing you behind the scenes to learn everything you need to know.
On today's show, we're talking about mommy makeovers. Here's a question from Felicia in Sugarland that was submitted in writing. Felicia wants to know, how long after I am done having kids can I have a mommy makeover, and is it safe to do more than one procedure at the same time? We typically want moms to have lost their baby weight, and operating too soon is not a good idea because, remember, it takes some time for the tummy to settle down after having kids, and that can take anywhere from 2 to 3 months. The other thing is, if a patient's considering breast surgery, you don't want to be breastfeeding while you're considering any elective breast surgery because the breasts, remember, when you're breastfeeding, the breasts are engorged from the milk ducts and the activity in the breast. And so you want to stop breastfeeding for at least 2 to 3 months to allow the breast volume to settle down. But typically, I've found approximately 3 months after having kids is the earliest you should consider any elective surgery for your tummy, and 3 months after you've stopped breastfeeding. Common question that I hear is, what is a mommy makeover? Now, mommy makeover is not a medical term. It's an umbrella, almost like a marketing term. It's an umbrella term that describes a set of procedures designed to restore a mom's breast body or other parts of her body to what it was before having kids. And for a lot of moms, even better than what it was before having kids. The common procedures that are typically performed on the breast are an augmentation with a lift by itself, or maybe a lift with a breast reduction. And now we're also adding in a lift with fat transfer augmentation. The common denominator procedure for most moms is a tummy tuck procedure, which is removing excess skin and fat and stretch marks from the tummy and tightening up those muscles that have been stretched out after having kids. And for moms that have C-sections, we clean up all that scar tissue. Very common for us to do some simultaneous liposuctioning. Now, most recently, there's been a lot of focus on curves in the buttock. And now I'm seeing moms request not a combined breast and tummy surgery. I'm actually seeing moms wanting tummy contouring with buttock contouring. So oftentimes a mommy makeover for these patients means fat transfer to the buttock, a procedure known or referred to as a Brazilian buttock augmentation with 360 liposuctioning, which means liposuctioning 360 around in the tummy, waist, and the posterior flank. So mommy makeovers mean different things to different patients. Now, is it safe to do more than one procedure at the same time? Different surgeons have different answers to this question. I can only answer this question based on my experience level over 17 years. And I think in healthy patients who are good candidates for elective surgery, it is very safe to do multiple procedures in one setting. The reason why different surgeons have different answers to that question is because every surgeon has a different surgery time for procedures. In my hands, my most common procedure that I do is a mommy makeover, which is a cosmetic breast surgery. It can be a breast augmentation lift, or a lift with a reduction in combination with a tummy tuck with liposuctioning. It's quite frequent that I say that mommy makeovers are truly transformative procedures, and I don't think that's an exaggeration at all. I'm thinking of one patient in particular early in my career. She was a mom of 3, and she came in for a consultation with me. This was a long time ago. And she had guilt. She was telling me, I don't want to be vain, but she felt guilty, that she was taking away resources from her family to even consider a mommy makeover. And I often hear that from moms. In addition, when she walked in, her posture was slouched over. You could kind of sense almost a negativity about how she was feeling about herself. She had a very supportive significant other who was encouraging her to get this done finally, now that the kids were a little bit older and they were in a financial place that they could do this for her. And she had an augmentation with lift, and we did a tummy tuck with liposuctioning of the waist. And I remember when I saw her a couple of weeks after surgery, she's healing great. A whole different person was walking into the office. Literally, posture straightened out. She was walking straight. She was glowing. She had positive energy. And it was a new lease on life for her. It just changed her confidence. She felt confident. She was ready to exercise. She wanted to go out. She wanted to go on the next family vacation. And so that's what it's all about. The worst thing that can happen is a mom undergoes a mommy makeover and they have not given any time for them to recover. That's just a recipe for a disaster. And so what we do is we tell patients to prepare for the healing process. That's really important. And what do I mean by preparing? Number one, if they've got a little kids at home, they need to get help with the kids. You cannot recover from surgery in a healthy way if you're running around chasing after kids and you got to take them to sports activities at school. So it's really important to either have some help with the kids, a family member, a nanny, au pair, or your significant other be available so that they can take the stress of childcare off your plate. Super important. Number two, you have to plan for rest and recovery. And so that means immediately after surgery, you have to have some time that you can rest and focus on your nutrition, your recovery, and continue with your follow-up appointments. So it's important to plan ahead so that you can have a safe outcome. If you do too much too soon, you can challenge the healing process. Comply with our recommended recovery plans. Patients do really well. And so I think it's all about preparation. Breast surgery is relatively easy to recover from. Patients who have breast surgery by themselves will have the surgery on Thursday and they're back to the office in a desk job by Tuesday, Wednesday, the following week. It's the tummy tuck that's more involved with the recovery. And I typically tell patients that they should plan to have help with the kids for about 7 to 10 days. They should feel after a baseline in about 10 to 14 days after surgery. Most women after a tummy tuck from a mommy makeover are comfortable to go back to a desk job at the office in about 10 to 14 days approximately. So in terms of taking care of the kids, I think they need to have some help for at least a week. When I say a week, I'm talking about, 5 days plus the weekend. So we're talking about 10 days. And then they should be fine to start resuming some limited childcare activities. But it's really important to plan ahead. Traditionally, we've talked about mommy makeovers as surgical procedures, but now there are effective non-invasive technologies that are alternatives to or complements to surgical procedures. I'll give you a couple examples. Part of mommy restoration after having kids is not only the surgical or incisional procedures, but we also offer ThermIva. ThermIva is radiofrequency vaginal rejuvenation. And this is a non-surgical, minimally invasive radiofrequency technique that my nurses perform on patients all the time. And they're incredibly happy with even just one treatment. Other non-surgical procedures can include cool sculpting for non-invasive fat reduction. It can also include other radiofrequency treatments such as body tight. So some moms are blessed that they don't need a tummy tuck, but they do have some mild or moderate loose fat and skin, which would often be improved with just doing minimally invasive radiofrequency skin tightening using a technology called body tight. So a tummy tuck typically takes me about 2 to 2.5 hours. If we're doing a larger tummy tuck, say an extended tummy tuck, it might take 3 hours. The operative time also depends on if we're doing any additional liposuctioning at the same time. About 80% of the time I'm doing tummy tucks, I'm doing simultaneous liposuctioning to help achieve a really nice hourglass shape that everyone wants. And again, if I'm looking at a typical tummy tuck with liposuctioning in the waist, that takes me typically about 2.5 hours. By itself, it can be safely performed as outpatient surgery. Typically, our patients are walking immediately after surgery within at least an hour after they're done surgery. One of the reasons why our patients are comfortable to walk almost right away after surgery is we love using long-acting numbing medicine. Of course, our patients are asleep during surgery. My board-certified anesthesiologist is watching them like a hawk during surgery. But before I finish my procedure, I actually inject a long-acting numbing medicine or local. And that numbing medicine, I inject it throughout the incision. That incision is that bikini line incision that goes hip to hip. But what really hurts after the tummy tuck, it ain't the incision. It's the muscle tightening that I do to give you that flat washboard belly. And so what I do is I take that numbing medicine, I inject that numbing medicine into the muscles and around the muscles, and that numbs up your muscles. And the numbing medicine I've been using for many, many years now, it's called Exparel. Exparel is FDA approved. It's very safe. I use it in all my tummy tucks, all my body contouring procedures. And the numbing effects of Exparel last at least 3 days. It's a huge game changer for my patients who are having tummy tucks and body lifts and larger procedures, because I now have tummy tuck patients, and I'm not exaggerating, I now have tummy tuck patients that do not need a single narcotic pain pill after surgery. Now, we give all our patients, a 1 week supply of pain pills because, pain varies from patient to patient. But I would say a good 20-25% of my patients come back now and they're just taking Tylenol after surgery and they're doing well. Again, pain varies from patient to patient. And we don't want our patients to experience pain, but the nerve blocks make a big, big difference in terms of the recovery of our patients. Some surgeons may keep a mommy makeover patient overnight in a hospital, and that's definitely an option. There's nothing wrong with that. we screen our patients pretty thoroughly, and I make sure my patients are healthy enough to have elective cosmetic surgery. In my hands, because we do some advanced pain control techniques, my patients are comfortable to go home the same day. In fact, they want to go home the same day. It's much more comfortable to sleep in your own bed. And like I said, one of the reasons why my patients are comfortable to go home the same day is we use nerve blocks to numb out the tissue. So they're not feeling any pain for 3 days after surgery. So my patients are walking in the recovery room before they even leave here. So they're more than comfortable to go home the same day. So what can be done about old C-section scars or hernia surgery scars? First, it's so common for us to see C-section scars when we're evaluating moms for a tummy tuck or a mommy makeover. And we remove the C-section scar at the time of the tummy tuck. And I try to place the tummy tuck incision line below the C-section scar. The reason why it's important to remove that C-section scar is because oftentimes the C-section creates scar tissue underneath that scar, and it creates a tether band where the tissue above the C-section kind of hangs over it. Think of it kind of like a pivot point, right? And so we got to clean up all that scar tissue so that they can get a much flatter contour in their tummy. And so typically it is very common for us to remove C-section scars. There are some folks that ask me, is it possible to do a tummy tuck with a C-section? And let me be blunt, that's a really bad idea. And I'll tell you why. When you're getting a C-section done, first of all, the OB-GYN needs to be focused on delivering your baby safely and keeping you safe. And oftentimes during a C-section, there is some blood loss. It's simply not a good time. It's not a safe time to do any elective cosmetic surgery at the time of a C-section. The second reason is you're not going to get a good cosmetic outcome because you're trying to tighten the tummy over a big enlarged uterus. What really needs to happen is that you need to give time for your uterus to shrink back to its normal size, which can take 2, 3, 4 months or longer. Once that's shrunk down, then your tummy will settle back down. Then we can bring you back and do a tummy tuck where you're going to see the results. So I think it's a really bad idea to consider any elective cosmetic surgery at the time of the C-section. No two mommy makeovers are the same. And I'm not suggesting that each mom is a snowflake, but I'm saying that each procedure is unique. And let me give you the example. Mommy makeover number 1 could just be a breast augmentation and a tummy tuck. Another mommy makeover could be a breast reduction with a breast lift with liposuction of the lateral chest wall with an extended tummy tuck and liposuction of the upper and lower waist. So the costs do vary. There are ranges. And I think the first point to start out with is to go to our website. But to really get granular information about the costs, it's important to speak directly to our patient consultants. And that's where you're going to get the most accurate information. And our patient consultants are experts at helping patients get the right financing package for them should they choose to finance their procedure, which is very, very common. So it's quite common for patients to fly in for surgery. Our patient consultants are experienced at helping patients with logistics in terms of travel arrangements. And so typically we try to facilitate the consultation with an initial virtual consultation so that at least we can have a discussion. Obviously, there are some inherent limitations with a virtual consultation, but I think that's a great first step for patients to be educated about what their options may be. I can evaluate their photos before the virtual consultation, so at least give them a preliminary assessment of what may need to happen. Of course, a physical exam is required before any surgery, which I do perform so that I can confirm what we're going to be doing or if we need to modify the plan based on the anatomy. But it's quite common for patients to fly out of state for their mommy makeovers. And prior to the COVID pandemic, we were seeing patients flying internationally to Houston, as Houston is the energy capital of the world. And we have a lot of international patients that fly in and out of Houston. And hopefully as the pandemic gets behind us sooner than later, we'll start seeing our international patients again. So to learn more about mommy makeovers, I encourage you to visit our website. We have hundreds of mommy makeover before-after photos on our website, which is Basu, B as in boy, ASU, plasticsurgery.com. Or you can follow us or find us on Instagram at Basu Plastic Surgery.
Take a screenshot of this or any podcast episode with your phone and show it at your consultation or appointment to receive $50 off any service at Basu Plastic Surgery and Aesthetics. Basu Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. To learn more about the practice or ask a question, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, TheAxis.io.